Hi.
Welcome back to the Great Imposters podcast.
Welcome.
It is a balmy, beautiful.
This is bizarre.
February 26, 75 degrees. We're sitting outside.
It's tricking my mind.
It's tricking my mind. I'm just going to roll with it.
They call this like the spring of deception.
Yes.
Right?
That's what we're in. And we're just going to stick with it. But we're in good moods because the sun is out.
Because vitamin D.
And because one of our dearest friends, who also happens to be a guest today, is with us.
Yes.
And I didn't want to give away her profession in that because I know that you're about to give her a really embarrassing. What'd you call it?
I like my intros, you know.
What'd you call it? An embarrassingly flattering? Is that what you said?
Yeah.
Intro?
Yeah.
Should we, with no further ado, shall we?
With no further ado, I'm just trying to decide if I should make eye contact or not while I do it.
Don't make eye contact.
Okay. All right. Okay. So today we have Melissa Walco, Dr. Melissa Walco. She is an OBGYN. Everybody say obstetrics a couple times fast.
Yeah, that's a tough one.
I find that word challenging.
Yeah.
She is wonderful. First of all, I think it's like hard to find a doctor that is like articulate and willing to do these kinds of things.
Yes.
So this is extra special. But two, she's just like this amazing like mix of like, she's obviously very much an MD. She is, delivering babies, but is so welcome and open to conversations that kind of mix Western and Eastern modalities, or like right now she has a ginkgo leaf on her earrings and a ginkgo leaf tattoo. Like she's like a spiritual being who's also an MD, and I think that's so rare, So I love that. Very, very cool. Yes.
And lovely and welcoming.
And I wish you had delivered my babies.
Yeah, but you're not having any more. So
yeah, and I'm not having any more. And someone sent me a meme about this, and I thought I was the only one. And I'm curious if you've ever done this. It's a cold open, Melissa. You ready? So when Cal was delivered, I had like the tarp up during the C-section because I don't like seeing guts. And my OB took him by like the head once he was out, like pulled the curtain down and went, "Hello,"
like a puppet.
Yeah, and it really ruined the moment.
That's the funniest thing I've ever heard.
Have you ever done that?
I've never made the baby talk.
Okay, good.
No, I have, many times held a baby up and
yeah, it's like, here it is.
Yes, like,
hi, Mom.
Okay, yeah, well,
here's little man, that sort of thing. But no, I've never given them a voice.
Okay, well, if you have like an impulse to do that, don't. Okay,
you'll ruin the birth.
Yeah, like even my husband was like, so odd.
That's
that's
so
my
weird.
First memory of my third child. Hello.
That's amazing.
Yeah, I think she's still practicing. I don't know, but welcome. We're just so excited to have you.
Thank you.
Thanks for being here, Melissa.
Yeah.
So, first doctor.
Yes.
On the Great Imposters podcast.
First doctor.
Because of that, spoiler alert for later in the episode, we put up a anonymous survey for you all to submit your Ask an OB Anything questions, and the questions are so good.
Yeah.
So many of them are very funny. So stick around for that. But first, Melissa, welcome to the show, and let's hear your stats. Give us your stats, girl.
Yeah, so I was raised in Murray, Kentucky, so just a couple hours north of Nashville, and went to college in my hometown at Murray State University.
I just saw them play a women's basketball game the other day.
Yes, that's how everybody knows them, is through basketball. College basketball.
That's like a thing. Okay, yeah. Got it.
And then I went to medical school at University of Louisville in Louisville, Kentucky.
Go Redbirds. Is it a Redbird?
Cardinals, yeah.
We like to
I knew that.
Mascots here.
I'm shocked.
I know. I'm so sporty.
Yeah.
And while I was at University of Louisville in medical school, I met my husband there. So we met our first year of medical school. We were both going on a trip to Kenya for a medical mission trip, and became friends and got married our last year of medical school. And then we moved to New York, and I did my medical training in New York City. And lived there for 4 years while we were doing our residency, and then talked my husband into coming back south, and we wound up in Nashville.
He's a Jersey boy, right?
He's a Jersey boy.
Yeah,
Jersey
he's
boy.
From New Jersey, and I like to say that he tricked me into going north, and
And you got him back.
and then I got him back. So
I feel like this is a good Nashville's a good compromise.
Yeah.
It's a great compromise. We both love it here, and then shortly, well, right at the end of residency, we had our first baby, and we had 2 more after that, back to back. So we have an 8-year-old, a 6-year-old, and a 4-year-old.
Wow.
So she does it all.
Yes,
is what we're saying.
She does. She is one of those. It's so cool to have you as a friend, because 1, the fact that you have time for friends is amazing, and 2, like you do it all. I'm gonna go for 3. Number 3 is that you are actually saving babies. You know, like how we all like shit on our own jobs. We're like, it's not like we're like saving babies, and then it's like.
Yeah. But she literally
She's
is.
literally saving babies at her job.
Exactly.
Yeah,
it's like
that's just,
saving lives, bringing life into the world. Like,
yeah,
like,
and we're just like, I write satire and you sell software.
Yeah,
you know? It's just wild.
Just yap on a mic occasionally.
Exactly. Okay, really quick, another aside. I'm probably gonna have a lot of these, but I feel like a lot of the doctors I know are married to other doctors.
Yeah, because everyone meets in med school.
You just think that's why?
Right?
Yeah. I think that there were a lot of couples in our medical school class.
Okay.
And a lot of our friends married each other kind of in our same friend circle. And I think it would be really difficult for me personally to be married to someone who didn't understand the stresses, the unique stresses of being a doctor. And also just the lifestyle.
I was going to say the schedule itself.
The schedule, the hours. I mean, it's, you know, especially in residency, it's pretty brutal. I mean, we got married the week before we graduated from medical school. We came back from our honeymoon. We graduated from medical school. We moved to New York a week later. And then right as soon as we moved there, I was working 80 to 100 hours a week for the next 4 years. And I can't imagine being married to someone who couldn't understand that I was only going to see them for maybe a few hours a week.
Right.
You know, for the first 4 years of our marriage. So,
or being married to like a finance bro who's like also working 80 to 100 hours, but he's just doing finance. And
right.
So you're like,
exactly.
You should watch the kids today because I'm saving babies.
And you're saving numbers.
Yeah. You're saving numbers. Yeah.
Right.
Yeah, and it's interesting too because a lot of the people in our medical school class, like the different specialties, they also kind of, the people who chose certain specialties kind of matched with the other like opposite specialties.
Oh,
like,
interesting.
So for example, if you in medical school, you basically go into 2 groups of people. You're either going to be a doctor that doesn't do surgery, or you're a doctor who does surgery. So you're surgeon or non-surgeon group. I knew immediately I was going to be in the surgeon group. I love to operate. I love the operating room. It's where my heart was.
Yeah.
And so my husband is a critical care doctor, so he works in the ICU, and he doesn't do surgery. Mm-hmm. He's cerebral, you know. He just is in his head. So, but that's kind of how the couples in medical school matched up.
Interesting.
I need to point something out there that you just said. This is a really fun fact for the audience because Melissa just said out loud that she loves operating, which means literally like cutting into people. Like that is quite literally what that means, which if I even hear that, I could faint. But Melissa, when you were at my house over the weekend, do you remember what you said grosses you out?
Oh, yes.
Do you remember what you said?
Yes.
Melissa, do you want to tell everyone?
Or when we were talking about teeth?
Melissa doesn't like when children's teeth come out.
She'll slice through 7 layers of muscle.
She will slice through all of your skin and organs. But when she sees a child's baby tooth coming out of its mouth,
get her out of there.
That's what makes her queasy, which I thought was so funny.
Yeah, I mean, I try to, you know, I've tried to kind of play it off. I'm like, it's not ready yet, you know. Maybe tomorrow when Daddy's here, you could ask him. He's stronger, you know. Yeah. But really, I'm just like, I can't do it.
It's so funny what grosses us out.
Yeah.
We had my husband and I had the same thing happen last night with teeth because Olive has this just dangler, just like ready to go.
Oh my god, I hate those.
Oh, and she's like playing with it all the time, and I am the one in our marriage that does all of the gross things. Like, I remove the ticks. Like, I deal with the everything.
Were you the snot sucker?
I'm the snot sucker.
Yeah, I was not the snot sucker.
And so I was like, I just turned to Andre and was like, you are the teeth guy. Yeah. I've done enough.
Yeah.
Get the tooth out.
Blair does them herself.
Okay, maybe I'll have Blair over to just pop that puppy out.
Yep.
She's going to see, Al's going to see her grandpa next week, and I was like, he's going to take it out, so you might want to get it out before him.
Yes.
You know?
We can coach her.
Yeah.
Okay, well, we have so much more gross talk later during the Q&A, but another amazing thing about Melissa, just given kind of how she was brought up in juxtaposition with her doctor life now, you've had a lot of jobs. Yeah. So let's hear about your first or worst job, because I know you've had a lot of jobs.
Yeah. So my very first job was at Taco Bell. And I started working there when I was 14. So I was in 8th grade. And
was that legal in Kentucky?
Legal-ish. Yeah. There were hour restrictions, but it's kind of like residency hour restrictions. Like, you know,
there's
kind of like it's like some, you know.
Yeah.
Like,
what was your role? Like, were you like tacoing or like drive-thruing?
Kind of all of the above. Yeah. I mean, by the time I left there, I worked there for a couple of years, and by the time I left there, I was, you know, assistant manager.
Wow.
And so
she's a businesswoman.
Yeah. I mean,
I thought this was like a little part-time thing. Like, you like worked at the ranks of Taco Bell.
Yeah. Yeah. I mean, I worked full time all through high school. So,
oh my gosh.
I mean, you know, at least 35 hours a week all through high school. So
what?
Yeah.
What time?
I mean, I worked pretty much every day. You know, I would go there after school, and then...
I mean, like, people work 35 hours now.
Yeah. I mean, I did
adults.
that through college, too. I mean, I worked full-time through college also. So...
Where'd you work in college?
I was mostly waiting tables.
Nice.
Yeah.
Yeah.
And... which is, I mean, I could go, that's definitely my worst job. I mean, waiting tables is...
It's ruthless.
Yeah.
Yeah.
I mean, it is. It really will make you hate humanity.
Yeah.
I mean, nothing will make you hate humans more than waiting tables. So shout out to my server girls out there, because, man, it is rough.
Just that much interaction with the general population.
Well, and the subservience that you have to have, you know, is really hard for me to, it's a hard pill for me to swallow.
Yeah. This is also in like kind of the Deep South pre-Yelp. So like there's nothing holding you accountable to being on your best behavior as a patron.
Right.
You know,
right.
Because there wasn't like someone couldn't be like, hey, this like douchebag at a restaurant was harassing the waitress. You know what I mean? Like there was none of that.
Yeah.
There was no discourse.
No one was going to film you being a jerk store.
Exactly.
Yeah. And also this was in my hometown, you know, which is in the, you know, rural Kentucky. Mm-hmm. So there's a certain population of people that I was having to wait tables.
Yeah.
So yeah, that was definitely my worst.
Okay.
And, you know, and I loved medicine too. And, so I worked at a nursing home for a while in high school. Most of the time I would have a couple of different jobs at the same time. And so I worked at a nursing home for a couple of years. I loved that. And then I worked as an aide in the emergency room for a year also. And that was all before I went to medical school.
Wow.
And then in med school, you really can't have any, you know, side jobs other than medical school. So when I got there, I felt like I was on vacation.
I was going to
say, time in my life.
That's amazing.
It was wonderful.
You've just been like, busting your ass since you're 14.
Yeah,
right,
you're
like,
wow.
Just like, look at me. I have free time.
Yeah, you want me to take time with the materials?
The only person I've ever met who said medical school felt like the vacation. That's
Everybody
amazing.
else is like crumbling around her, and she's like, "Listen, guys, I was at Taco Bell when they introduced fourth meal. Okay, do you have any strong opinions about what's the Mountain Dew flavor there? Baja Blast."
No, you know, I don't know the whole lot about the current day Taco Bell.
Yeah, that's
I was gonna say, does your past employment have anything to do with the fact that you're now a vegetarian?
Yeah, no, I mean,
Horse
mean,
tacos.
yes, we could definitely go into, why no. So, no, not necessarily, but,
Okay.
but being in medicine definitely plays a role in why I'm a vegetarian.
sure.
I'm sure.
For sure.
Yeah.
So I think another thing I love about Melissa, just having a doctor friend who's so close to us, especially a woman's health doctor, you didn't take like necessarily a straight path, because when I think about OBs, I think about like the women we go to at their practice that do your pap smear and deliver your babies. Like, I'm not saying that that's a simple thing, but you haven't followed that exact track.
Right.
So I think it's also inspiring maybe to tell our audience a little bit about the track you've taken and where you're at today with obstetrics. And it's just, I think it's unique kind of, right?
Yeah. I think it's becoming a little bit more common. And I can get into a little bit of that as well. So, when I finished residency, I immediately joined a private practice here in Nashville. That was wonderful. And I loved it. But the way that obstetrics is structured in private practice, I believe, is very antiquated. Mm-hmm. And I think that it was really worked well back when most OBGYNs had a stay-at-home partner.
Mm-hmm.
And so, I mean, yes, of course, that was most OBGYNs were men and they had a stay-at-home wife.
Right.
Which is so crazy because I feel like there's so many women now.
Right.
Yeah.
Right?
Absolutely. Yes. And so I think that the practice model has not grown with the changing times and the changing family structures in medicine. I mean, there's a much greater proportion of, not much greater. There are more women than men in medical school today.
Woo!
I mean, there's like 52% women to 48% men. Don't quote me on that, but there is a slightly, greater population of women than men in medical school. But so I think that the structure of OBGYN in private practice is more based on, the 60s.
Yeah.
And so when you're in private practice OB, your whole life really has to be about that.
Yes.
And as someone who just really deeply not just cares about my patients, but really connects with my patients and really, I loved them. I wanted to be there for them. I wanted to be the one delivering their baby. I wanted to be the one that, was able to do their C-section and come in for their delivery. And after 5 years of that with 3 children under the age of 4 and a very busy private practice and a husband who is also a very busy doctor, every day I just felt like I was disappointing every single person around me all the time. I was disappointing. There was nothing that I could do for anyone that was enough, because you only have so much to give, I mean, when, my therapist says all the time, like you can't pour from an empty cup, like once it's empty, there's just nothing left to give, right? Like, and that's how I felt every day. And
that's just like the plight of working mothers.
Mothers, yes, exactly.
It's like somewhere you're not giving, like you're always, what you just said just like resonated so much. Like I always feel like I'm disappointing someone.
Yes, exactly.
Right.
And
you're either, it's like you don't ever get to excel at one of the things without letting another one fall by the wayside, and that's so hard.
Exactly. And so it came to a point where after we had our third baby and my pregnancies were also difficult, but after we had our third baby, where I just reached a point where I couldn't live like that anymore. I couldn't. Something had to give one way or the other. And of course, my partners who had the best of intentions, and I love them, and strong, amazing women, are all like, just get a nanny like everybody else.
Yeah. But you enjoy, that is something really beautiful about you too, is like, it's so obvious how much you enjoy motherhood.
Thank you.
And
Girl, it's definitely my hardest job
for
sure.
Yeah.
I mean, my doctor job is like that's my vacation
Right.
time.
Yeah. Yeah.
So yeah, and it's just such a brief period of time that you have with your kids, you know, in your life. I mean, it really is just such a short window of time that you have with them. And I mean, even now, even though I left my practice when they were little, I still feel this just extreme guilt over the time that I missed with them before I left. All of the, they would see me in scrubs and just like be hysterical, just like, no, please don't leave.
Yeah.
And so it was very hard to leave my practice. It broke my heart. I was very, very sad about it. I loved my practice. I loved my partners. I loved my nurse.
Mm-hmm.
Loved my patients. And it was one of the hardest things I've ever done. But ultimately, it was the best decision I have made in a really long time, because everything in my life has gotten better with my family, and all of the things that I hold near and dear to my heart have just really taken the forefront in my life. And it just, like, a peace has come over me that was never there before. And so I switched to hospitalist medicine. So
this is what's so, like, very inspiring about you, is that the way you're telling this story and leading up to it is like, and so now I'm, writing books on women's health in my free time. And it's like, no, you are still a practicing OBGYN in the hardest setting possible. So
it would be funny if, like, everyone who's like doesn't know Melissa is probably sitting on the edge of their seat listening, being like, oh, what entrepreneurial thing is she doing now at home? It's like, no, she still works in a hospital.
She went from private practice to the emergency room.
Right.
Yeah. Currently, I work at a couple of different hospitals. So an OBGYN hospitalist, essentially you are the OBGYN who stays in-house the entire time. So you're in the hospital for typically 12 or 24-hour shifts, and you can kind of pick your own schedule, and then you work a certain number of those shifts per month. And so shift work is really a recent trend in OBGYN. And I think that it's a recent trend because there are more women in OBGYN. This is the, kind of what we started the podcast with, is kind of leading into this shifting roles in OBGYN. And so there's a lot more hospitalist roles because most OBGYNs don't want to be in the hospital all the time. When you have a patient in labor, you want to be able to go home and have dinner and then come back, and have somebody that's there in case something happens with your patient, in case there's an emergency, in case your patient comes in and, is having a baby very quickly or needs an emergency C-section. And so that's the role that I have. Is I work in the OBGYN emergency room at 2 different hospitals, and then also cover all of the emergency GYN surgeries at those hospitals. So I do patients that come in with, ruptured ectopic pregnancies, ovarian torsions, that sort of thing. I do those surgeries. And then I also do, at one of the hospitals I work at, I also take care of the high-risk patients. And so there's certain patients whose pregnancies are so high risk that they essentially have to live in the hospital until they deliver.
Is that antepartum?
That's antepartum.
Okay.
Yes. And so that, at one of the hospitals I work at, we cover all of those patients and do all of those deliveries as well. And so those deliveries are really the most difficult deliveries that I've ever done, and definitely the hardest role that I've ever had in medicine. And Yeah, so both, the combination of those two hospitals and the combination of those two roles. One of the hospitals I work at, I have a teaching role with the resident, so I'm an assistant professor for the resident OBGYN, and I get to teach them. And
Do you like that?
yeah, I do.
Yeah.
I always liked it in residency. When I was chief resident, I loved teaching my junior residents. I liked, yes, I love teaching.
Yeah.
And so that's my job currently, and
Wow.
and I love it. It was one of the really hard things for me to come to terms with when I was in private practice OBGYN is that medicine is a business.
Mm-hmm.
And I foolishly did not realize that in medical school. I was becoming a doctor because I wanted to help people, because I wanted to provide a service for people who couldn't necessarily help themselves, and when I got into private practice, I realized that no, you also have to make money, and you have to be a business person. And because of that, and because of the way that medicine and insurance companies are structured in America, it is very difficult to be a private practice doctor and also take care of underserved, underinsured, uninsured patients, which for me is extremely, extremely important. And I tried to do that in my private practice.
To almost have like a pro bono kind of.
Absolutely.
Yeah.
And I did a lot of that, but you can't pay your bills like that. I mean,
right.
You really just can't. That's just not the way that medicine is structured in America. And so when I switched to this role, it's a relief for me, because I don't have that kind of financial burden in the back of my head. I just can take care of the patients that come in, and not have to worry about that. Well, they don't teach you anything about the business of medicine. We had maybe an hour lecture on it, but we don't. I knew nothing about it when I got out, and you really are essentially running your own business.
Totally.
When you're in private practice, I mean, you have a practice manager, but you have to know the intricate.
Okay, that leads. I'm gonna take it a little heavy because I like to go there. So I just feel like this is such a fascinating path that you've taken, but particularly what I love about you and like your kind of philosophy on medicine is a lot of what you've talked about, of like making sure the underserved have access. We're all very, highly aware of the really not good maternal death rates in this country, and all of that. And you're also in a field of medicine that is like, for lack of a better phrase, under attack right now.
Right.
It's like at the forefront of politics. And so you talked about, making sure that medicine is available to all. You talked about insurance and how that has become such a business, and it takes away, the patient. It takes away some of the patient doctor care piece, because you have to be thinking about things as a business. And then also, when you think about women's health and just reproduction in this country, those are like, it's like every hotbed issue you could think of is impacting OBGYN. That was a long-winded way of saying that, sorry. So how do you, I guess, like, what keeps you up at night the most of all of those things? Like, where's your mind at when you think of the future of obstetrics?
Yeah, there's so much in that question, Annie. There's like 4 questions. I'm gonna take it. Break it down a little bit.
Break it down, girl.
So, one of the let's talk about the maternal death rate in America.
Yeah.
So I have a couple of different thoughts on that. One of them is that you know, the maternal death rate in America is the most unhealthy developed nation in the world.
Yeah.
Okay. You know, nutrition is very near and dear to my heart. And, you know, the food and drug companies in America are really unregulated in comparison to other developed nations. And so America in general is just unhealthier than other developed nations. So that plays a large role in maternal death rates and maternal morbidity and mortality, is just because we're an unhealthier nation, you know? So that's part of it. And I mean, that is a lot of, I mean, I think that that's basically a lot of food and drug lobbyists that put money in the pockets of politicians, right? That's why this continues. Why we're allowed to put a bunch of poison in our food, and everybody's just kind of like, well, this is fine. This is just what's happening, right? Yeah. And every time I go eat lunch with my kids at school, I'm just like, you know. You know. So that's part of it, is that America in general is an unhealthier nation. The other part of it too is that why there is a discrepancy in what population of people are dying in America, maternal mortality, right? This is largely underserved and minority mothers who are at greatest risk of pregnancy complications and death in childbirth or death after childbirth. And, you know, this is a long line of generational poverty that is extremely difficult to overcome, and very difficult for anyone who has not lived in it to understand.
Yes.
And I have talked about this with so many people. I've talked about this, you know, my husband and I kind of grew up in very just completely different worlds. And, you know, if you asked my husband, and I'm not picking on him, and I know that he'll listen to this, but if you asked my husband when we first met, he's like, oh, I grew up middle class, you know, middle class in New Jersey. And, you know, and Joelle, you might say the same thing, you know,
100%.
Right. Yeah. Exactly. So, but that is in my world, in the place that I grew up, in the life that I grew up in. I mean, my husband was
a Rockefeller.
He had a dream life.
Yeah.
You know, and so I think that it's very difficult if you haven't been in that life and you don't understand what it's like to have this constant stress of food insecurity, of, you know, just the environmental exposures that you get when you live in poverty, when you live in, you know, an uncomfortable, unsafe, unclean environment, then that also really affects your health. Lack of money, so you can't buy healthy food, and then the food that you can buy is much more exceptionally unhealthy than every other developed nation.
Right.
And then you also have all of these external environmental factors that are also affecting your health, affecting your happiness, affecting your pregnancy, affecting your baby. And, you know, I just think it's really interesting to me when there's this question about why are pregnant American women, why do they have all these complications in comparison to developed nations? Right. And I really do think that generational poverty is really kind of at the heart of all of that. And it's very hard to get out of. you
Yeah.
know, and it's it affects everything in
Yeah.
your life.
Everything.
Which again is another reason why I love the role that I'm in, because I can take care of women from every walk of
I was
life
just
and
gonna
every
ask that.
aspect
Yeah.
of life.
Do you feel like that purpose within you is much more fulfilled now?
Absolutely.
Yeah.
Yes. I mean, I did that a lot in my practice as well, but I get to do it much more so now.
Yeah.
And yeah, and I see it a lot more now in the role that I'm in the emergency room.
You do?
Absolutely.
From other practitioners? Or-
No, because I just see those patients that are really suffering, you know, the patients that haven't
got
been
it.
to an OBGYN their entire pregnancy because
Yeah.
they just can't go, you know? I mean, they don't have transportation, right? The only
right.
time they can come to the hospital is if they call 911 and get an ambulance. They don't have money to get an Uber. They don't have transportation. They don't have a car.
Mm-hmm.
There's a lot of emphasis on, let's just talk about Roe versus Wade, for example.
Yeah.
Okay, when Roe got overturned, everyone I know, most 98% of the women that I know in women's healthcare were devastated.
Yeah.
But for me and the patients that I work with that are underserved, it didn't affect them. Because when you're living in a red state like Tennessee,
Mm-hmm.
even when abortion was legal in Tennessee, you had to pay out of pocket for it.
Right.
It was not covered by insurance.
And have a ride and all those limitations
And
we just talked
you had to pay for it up front. I mean, $500.
Yeah.
You know, if you wanted to terminate a pregnancy.
Yeah.
And it was not easy to find those places that
Right.
provided that care. So for a lot of the patients that I see, they didn't even know that Roe got overturned. I mean,
Right.
it just never applied to them. They're like, I mean, $500, that's something that I have never seen and never will see.
Yeah.
Right.
And $500 that I have to spend on an elective medical procedure.
Yeah.
Right.
Right.
So I think that it's almost, you know, it's almost the patients who I feel like it really truly does affect the most. They're just, you know, like,
Yeah.
I mean, who could ever do that, right? Like, I
Right.
can't. So I don't think that. I do think that there's just this kind of like binary group of people. Like, you either are someone who can care about,
That.
have the time and the energy and kind of the space in your heart and your life and your head to kind of care about that. But a lot of the women that it affects the most, I mean, they're living in such a stressful environmental situation. I mean,
Yeah.
when you are living in poverty, the environmental stressors around you are such that this kind of I mean, it's almost just kind of like this
Amorphous. Yeah.
amorphous thing that's just like
Yeah.
that's something rich people care about.
Right.
Right. Right.
Wasn't even on the table to begin with.
Right.
Yeah.
I mean,
Yeah.
I mean, it's just not something that would have ever been available to them. And then
Right.
the other side of that too is that in states like, you know, New York, for example, where it is covered by insurance, it's still covered. You know, it's still there. So, you know, I don't know that it has changed a whole lot for most people. If you could afford to pay for it in Tennessee before Roe got overturned, then you drive to Illinois.
Right.
You
You can
know,
still-
and it's really not, I haven't seen it affect the patients that I deal with on a day-to-day basis because they were already kind of living in this situation. They were already living in a post-Roe
world.
before
really
Roe ever
interesting.
got overturned.
I think people will be surprised to hear that reality of
Yeah.
it. Yeah.
So if you were to talk to somebody who's in medical school and they're considering OBGYN right now,
yeah.
and you know, everything that you just said and the fact that the more traditional path, you're likely not going to be kind of serving the communities that are necessarily most at need of accessible obstetric care, but would you, like, how would you give them hope for the future in women's health? What would you say to them?
I do work with medical students
Right.
that are
Okay, yeah.
choosing. Yeah. So I do work with them. And when they ask me about OBGYN, I mean, I tell them to run for the hills. So, I mean, just to be fully honest, and part of that is that, you know, kind of going back to our intro and our icebreaker, it's a very difficult role if you want to be. It's a very difficult role as a working mother, and it's also, I mean, we can get into all of the gender inequalities that, you know, are alive and well in
Right.
medicine, and why OBGYNs are the lowest paid surgical subspecialty, even though we have 2 patients and we're doing extremely high stress surgeries all day, every day, and very difficult hours. But
Yeah.
you know, we can get into all of that, but just because of the way that it is structured, I mean, you're kind of setting yourself up for
For
just a very stressful and
Yeah.
difficult life. You know, I mean, would I do this all over again? I probably no. You know, I mean, would I do medicine all over again? Absolutely. And it's not because I don't love women and care. You know, I am a diehard feminist.
You're the biggest feminist I know.
I love women, but
And you hate men.
I mean, not all of them,
No.
but
Select
not
few.
all of them. There's a handful that are.
Yeah.
There's some good eggs out there, but I'm trying to raise a good one myself.
You're doing it. You're doing it.
Trying to fight the good fight. But yeah, I don't know that I would. I don't know that how I would tell them to make it better. You know, and it.
Yeah.
And it's,
Last thing,
Yeah,
real quick, before we
go.
do that. Now that you've listed all of these different things that you have done and done well, what do you think you're great at?
Oh, yeah.
It doesn't even have to be medicine, anything. What do you think you're great at?
When someone asks Melissa Walco, doctor or not, what is
Yeah.
Melissa great at?
yeah, I think that I'm great at being cool under pressure.
Totally.
Thank God.
You're also
Yeah.
great at operating on no sleep. That's something that a lot of people can't say.
My husband calls me the sleepless wonder. Yeah, 'cause I'm just
Didn't you tell me that you had a leg up on everyone in medical school because everyone else like was getting used to not sleeping, and you're like, oh, I'm fine like this.
I've slept since the 80s. I'm fine.
Yeah.
I mean,
Yeah.
I'm good.
She's just been awake through
Yeah,
it all.
just
awake.
just wide awake. I know my poor baby, my youngest. She's told me the other day. She said, "Mommy, I just lay in my bed and stare at the ceiling." I'm like, same girl.
Oh, that's my middle. It's like a
But
gene they need to isolate.
Yes.
Sleepless gene.
yeah, and I thought it was funny too because your last episode, Joelle, you said the only person that I don't want to have imposter syndrome is my surgeon.
That's right.
Well, I'm a surgeon, so
That's true. That's so true.
but so yeah, I think even with my imposter syndrome that I have, and I'm sure we'll get into that I still have occasionally. I think that I'm good at being cool under pressure, and I think that that's, as a surgeon who does emergency surgeries, that's the most important thing. The absolute most important thing when you're in the operating room is that you have to project a you have to project calmness, and you have to project confidence in yourself, even if your heart is beating
Out of your
200
chest.
beats per minute and you feel like you can't breathe. You still have to project calm, and I think that I've practiced that, and maybe, you know, I'm sure some of my colleagues and some of the nurses that I work with may, you know, like, I've seen her not be calm before.
Yeah.
but I really try hard to do that, and I think that I've gotten good at it.
Are some surgeons not very calm?
Oh, my girl.
Really?
Yes, absolutely. Yeah.
But they wait till the patient's asleep, and then they're just like, everybody.
Yeah, I
There-
sure hope so, because
I have seen a lot of surgeons. I mean, I've been in the operating room with surgeons that are throwing instruments across the room
Stop.
and cussing people out, and
Oh my gosh.
absolutely. I mean,
The ego.
yeah, it's 100%. There are, you know, and if you were, this is like this in any aspect of life, right? So as a mother, as a wife, as a doctor, as a teacher, whatever, if your reaction is like screaming and anger, right, that's because you have like some internal thing happening inside you, right? And most of the time, when that's the way that manifests as a doctor, if you're screaming at someone else, it's because you're scared, right? You're worried about something, or you're feeling unconfident about something that's going on, right?
A trigger, if you will.
Right,
Yes.
exactly.
Wow.
would you say, I don't want to put you on the spot, but I think I know the story. I think I already know the answer because we know this story, but it's a really good segue from what you just said. A time that you had to confront your imposter syndrome. Annie and I know this story, but I think our audience would love to hear it.
Yeah, and I just want to say to you that it's imposter syndrome was something that I have known about basically my entire life. And I won't get too much into it because I'm not going to give you my whole autobiography here, but
Because
you know,
she's going to write it later, and you're gonna pay
but-
for it,
but-
bitches.
but you know, kind of growing up in poverty and growing up in a small town in that kind of role, you're pushed into a category of people that, you know, you grew up in the trailer park, so you're going to get married in high school, and you're going to live in the trailer park too, and then, you know, you're going to kind of just follow this path that's laid out before you that everyone has decided before you're even born. You know, I mean, this is just what's going to happen. And so when I made that decision when I was a very young child, I mean, from the first time I've had memories, it was just like, no, I am not going to, I do not accept.
Yeah.
And
I will not accept this fate.
yeah, I'm just not going to do that. And so I decided I was going to be a doctor very young, and kind of was always following my mom's a nurse. She graduated from nursing school when I was in 8th grade, and has just been
Wow.
such an inspiration for me. She's just this strong, amazing woman that just does it. She gets
Yeah.
it done. And so anyway, she was a big help and a big encouragement for me. But I felt imposter syndrome essentially the entire time I was trying to become a doctor, because every test in college that I took, I was just like, I'm gonna fail. You know, like 100% of them, like my mom, how did it go? I probably failed. I failed, you know, and I didn't, of course I didn't fail. If I'd been failing tests, I wouldn't have gotten
Right.
into medical school. But so I had imposter syndrome essentially all through medical school, and then got to residency, and in residency, I really
don't-
didn't have the time for it.
I was
you
gonna
know?
say, they don't let you
I
have
mean,
it
they're
there,
just
right?
like, get in there and do it. You know, they kind of throw you into the fire, especially in New York City. I mean, they're not holding your hand. So I got over it in residency, and kind of gained a lot of confidence in residency through through my training and becoming a doctor and learning surgery, and also just being around all of these really amazing, strong women that were teaching me and were my friends and my colleagues. And I will say too, you know, a shout out to my husband. You know, he also was really intrinsic in helping me overcome my imposter syndrome, because he's just like, you're amazing, you know?
Yeah.
I mean, just from the time I met him, the very first time I met him, you know, has just been nothing but, you know, lifting me up.
Yeah.
Oh, Jer.
And so,
I love that.
yeah, so I kind of overcame it. And then I would say too, you know, especially when I was chief resident, I was probably a little bit cocky, and a little bit, you know, just like, I mean,
That's how I like my surgeons.
right, like, this is easy. Like, what?
Yeah.
Like, what are you people stressed out about right now?
I
And
mean, you faked it till you made it, and then
right,
you made it.
yeah, and then
So then you were like, listen.
yeah. In the words of T Swift, you know,
Yeah.
like and so yes, so I left residency with this kind of confidence that, you know, I was like, wait a minute, I'm a good doctor,
Yeah.
you know, like I'm good at this. And then I got into private practice, and you know, that was kind of a learning curve too, just for, you know, just kind of learning the intricacies of that. But then when I left private practice and went to my first role as a hospitalist, where I was taking care of these really sick patients and doing these really difficult and high stress surgeries, it came crashing back. You know,
Wow.
this imposter syndrome that I felt just came crashing back, I mean, hard. And there was this moment, you know, again, on the antepartum service, patients basically live in the hospital. So you know them very well. You know, that's their apartment, essentially. And you're seeing them every time you work, and kind of in this journey with them together. And I had a patient that had a very high-risk pregnancy, and a tiny preemie baby that she was just trying so desperately to hold on to. You know, we're trying to extend the pregnancy for as long as we can to let this baby grow and try to deliver it so that it wasn't so premature. And it came time that we had to do it. We had to do the delivery. It was in the middle of the night.
How many
you know.
weeks was she? Do you remember?
I mean, the baby was around a pound, maybe, you know, there was, so I had to do the delivery, and I had to do it quickly. And they had wheeled her into the operating room, and they were prepping her for surgery. And I was watching them prep her belly for surgery, and she didn't even look pregnant. I mean, her belly was almost flat. That's how small this baby was. And her placenta was in the front of her uterus, which means that when you make the incision on your uterus, and I know you have a weak stomach, Joelle, so I won't.
It's okay.
Earmuffs. So when you make the incision on the uterus, you're basically cutting into the placenta. And so you have to get the baby out very, very quickly. And these little babies and these little uteruses, it's very difficult to do that. And I saw them prepping her for surgery, and I went to go scrub. And when I was scrubbing, I mean, I just had this, I just felt like full-blown panic attack, you know. And if you've ever had a panic attack or had any kind of anxiety that you felt like was kind of taking over you, you know exactly what I'm talking about. I mean, I felt like I couldn't breathe. My heart was racing. I felt like I couldn't see. I couldn't hear. I mean, I just, like, I was about to pass out. And just this anxiety that overcame me, you know, what if I can't get this baby out? What if I can't get it out in time? What if, you know, all of these kind of hypothetical scenarios that I was running through in my mind, and this patient that I really cared about, and this baby that I really, really cared about. And you know, while I was standing there about to scrub and all this is running through my mind, I just kind of channeled my best friend who is, you know, been teaching me mindfulness and meditation in, you know, against all of my resistance in our entire friendship. She has gotten through to me, and I essentially meditated. You know, I had this moment where I was just like, no, it's only you. You are the only person that can do this, because you're the only doctor in the hospital right now, and this baby needs you, and this patient needs you, and you just have to do it. And I felt my heart slowing down. I felt this calm come over me, because it was me. There was no one else. There was no backup. There was no one else around. It had to happen. It had to happen right then, and it had to be me that was doing it. And so I meditated in a, you know, and that's how my meditations still work, is a 30 to 60 second meditation that I do, because that's all that that's the only amount of time that my mind can slow down for.
Yeah.
And yeah, it was the worst imposter syndrome I've, you know, since my test taking anxiety in med school, that I've ever had. And ever since then, I haven't ever felt that type of panic ever again.
Wow.
You know, I feel, of course I feel adrenaline, you know, when I'm doing this type of situation, but I don't feel an anxiety, and I don't feel scared.
Wow.
So
it's very inspiring.
Last time you told this story, I was too drunk to cry, and this time I'm like holding back tears. That's so amazing.
It really is.
Do you think your nurses in that instant were aware of your panic, or no? I'm just curious.
Yeah, you know, I probably, you know, the nurses too at that I work with at this hospital are just, you know, they're rock stars.
Seasoned.
They're you know, they're my right hand gals, and they're here for me, and I'm there for I hope that I'm there for them as well. And so yes, you know, and in fact, one of the first assists, so the person who is essentially assisting the surgeon in the operating room, who's just this amazing woman, she came up behind me right before I made the incision on that patient. And I mean, I wasn't saying anything. I hadn't spoken these words out loud, and she came up behind me, and of course I'm scrubbed and sterile, so she put her hands on my shoulders and just said really quietly, she's like, "You've got this. Like, you can do this, Dr. Walco. Like, we believe in you." And so shout out to Donna, Angel.
Donna, girl.
And so yeah,
Way to read the room,
I think that yes, you know, the team of people that I work with in general, I care about them and trust them, and we work together. And so yes, I'm sure that they had some idea that I was feeling that anxiety, but I don't know that I was showing it externally that much.
Amazing. I want to clap.
Love it.
Oh, are
right.
you ready to switch gears and play Ask Dr. Walco?
Yes.
Dr. Walco?
All right.
Yeah,
well,
let's do it.
We're running pretty deep here, so I'm gonna go quick.
Do you have a time you have to stop?
I mean, I already had to push a call, but
Oh, okay.
it's good. We'll just do them like, I feel like this is kind of a...
Sorry, I'm like
No, you're
long-winded,
good.
girl.
Are you okay on time? 2:20?
Yeah.
Okay, cool.
Okay. So, all right. So as we said, Annie and I posted a like anonymous input survey so that we could get anonymous questions that we knew that you'd be too embarrassed if your name was attached. So we literally have no idea who sent these in, except I do know my brother's, because he just, I'm not going to read it, but he just wrote like a funny
No, please do.
You want me to? Okay, I'll start with that. My brother quoted 40-Year-Old Virgin and wants to know from Melissa, is it true that if you don't use it, you lose it? It's very, Melissa loved that one. It was, if you know the movie, you know that was a moment. So,
well, and we all had, I got like a kind of a sneak peek of these.
Yes, we gave these to Melissa to vet them first. But
so when I was at the hospital yesterday, I got to read these and was reading them to some of my colleagues at the hospital, and we all thought that one was very, very funny.
Yes,
and,
I love it.
And so tell your brother that we all had a good laugh.
I love it. Amazing. Good
but
job.
Kind of, yeah. Like if you don't use it, then you get less confident, and
that's true.
Yeah, I mean, we could go into that.
Yeah,
absolutely.
Yeah.
Yes.
So I'm gonna go down these and read them, and I just want everyone to know I am actually, for being such an outspoken person, I'm very like prude about this stuff. Ooh. So I feel like I'm gonna squirm in my chair talking about vaginas and like on the air. Okay. First one, what happens if you're 26 and you've never gotten a pap smear? Is it too late? I feel like I can answer that. No, and make an appointment. But Melissa, what is your...
Yeah, so no, absolutely, yes. You should definitely make an appointment and go for your pap smear. I've done pap smears on, interestingly, when I came to Tennessee, there's a lot of, we're in the Bible Belt, and there's a lot of virgins in their 30s here. And so yeah, I mean,
is that the general rule of thumb? Like once you're sexually active, you should.
Yeah,
start?
I mean, the general rule is age 21, but if you've never been exposed to HPV, right? In the majority of cervical cancers caused by HPV, human papillomavirus. Human papillomavirus is an STD. If you've never been exposed to an STD, then yes, theoretically. But that being said, in general, we say age 21, and then, because sex and intercourse, there's like lots of gray areas. So in general, we say age 21 for your first pap smear.
Love it.
But definitely when you start having intercourse, absolutely, whenever that may be for you.
And is it how many years apart are they now, pap smears? What's the I feel like every time I go in, it's a new
so it's not a set criteria because it's based on what your previous pap smear, it's based on your history.
Okay.
But in general, we say still come in for an annual every year, and then we do pap smears typically every 3 to 5 years, depending on what your history is. But if you've had a history of abnormals, it may be sooner. So you really have to kind of defer to your OBGYN because there's kind of a complicated algorithm for how often you should have a pap smear.
Got it. Okay, so I'm going to skip one because it's on the same topic. Can you ask for a Xanax for your first ever pap smear?
Most OBGYNs are probably not going to provide that for you. No. So, and I'll say this too, it's really... I mean, it's not painful, it's nerve-wracking because all OBGYNs are bad patients, right?
Right.
One of my former partners is my OBGYN, and she basically had to like strong arm me into the exam room because I'm just like, I'm probably fine. Yeah. So
I just have a sixth sense.
Right.
Yeah, I'm right.
So yeah, I mean, it's not going to be painful. Nobody enjoys it. You're probably not going to need a benzo.
Okay, you're going to be fine.
You're going to be fine.
How grossed out do you get of seeing vaginas?
Not at all.
Good.
I mean, vaginas, it's once you've seen one vagina, you've seen them all.
All right, you hear that, people? Relax.
You hear that, men?
Yeah.
Once you've seen one, you've seen them all.
I mean, and I have a lot of friends who are patients as well, and
you do?
Mm-hmm.
Oh, I didn't know that.
And in fact, my best friend, every time she would come and see me, she'd have this anxiety. I'm like, girl, you're fine. Like,
we all got one.
It's completely fine.
All right, same topic. What do you say to people that are nervous about their grooming situation during exam, pregnancy, delivery, etc.?
Oh gosh, I tell patients all the time. I feel bad that they have anxiety over that. I'm like, first of all, I don't care about your pubic hair.
Yeah.
Like, it's just not. It's not factoring into anything that I'm doing whatsoever.
You're not even like thinking about it.
I'm not thinking about it. I'm not looking at it. It is just a part of your body, and every OBGYN I know feels the exact same. I've never heard or even I've never overheard anyone saying anything differently. So no one cares is the point.
Love it.
Right. And I also feel like too, just as a feminist also, not that we should go like full on 70s here, but I mean, waxing is
barbaric.
It's barbaric.
Yeah.
It is.
Yeah.
It is like I'm never doing that again.
Yeah. Yeah.
Like it's just,
Like,
I'm like, why are we doing this to
Right.
ourselves? Like, this is just extraordinarily painful and very unnecessary. So,
What can I do to address low libido in my early 40s?
so early 40s is interesting. And if you look at the algorithm for low libido, I mean, it's like this kind of like long-winded blah, 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 make sure that there's not an emotional stressor, blah. So if you have none of that, right? I mean, you know, if you're not attracted,
So if you have kids,
if you're not
sorry.
attracted to your partner, okay, well, like that's step one. Like
Yeah.
that's why you have a low libido. Like
Right.
it's easy to solve. Like, right?
Make his ass go get waxed.
Right.
Yeah.
But if that all being you are in a healthy, happy, supportive relationship and all of these things, and you just are like, I don't feel like having sex anymore, then there is a medication that came out pretty recently. I mean, I want to say within the past 5 years. It's the only medication that is marketed for women with hypoactive sexual desire disorder. So low libido, essentially. And of course, like all like women's healthcare in general, it's, in general not covered by insurance and in general fairly expensive.
This makes me
But
so
there
mad.
is a medication available that you can take that has been shown in clinical trials to be effective at helping women with low libido. So that's premenopausal women. I mean, early
Right.
40s is typically premenopausal. Postmenopausal is a different story, and that's kind of a whole
Other
separate
podcast?
subject. Absolutely, yes.
Okay, got it.
But there are some tricks out there. If you have low libido because you
Some tricks.
yeah, some tricks. Yeah, we if you have low libido because you're having, pain during intercourse or then again there's a lot of other things that we could get into. So
This is so helpful because I feel like a lot of women are probably just very nervous to even talk about this, even especially in a clinical setting. So just knowing that.
Absolutely. I had patients talk about it all the time. I mean, it was probably one of the most common complaints that I got for patients in their 40s, other than why is my hair falling out and why am I gaining weight?
Got it. Yes. All right, so ask your doctor for the women's Viagra.
Yep.
Yeah.
What's the worst baby name you've ever delivered? Can you say that?
Okay. I thought about this question, and I
thought that was a hilarious question.
And
by
I
the way.
do know what it is. I do know the worst baby name, but I don't want to say it.
Okay, that's fine.
Because I care about this patient and I really love her, and she had a reason for it. So
Okay.
I don't want to share.
So maybe you'll tell us after.
I'll tell you after.
Okay, and if that was your question,
JD.
DM me and maybe I'll tell you if I know who you are. Okay. What is the biggest misconception that pregnant women have about pregnancy?
That you can plan any part of it. Yeah.
Mm.
So, I mean, we could get into birth plans, which I think are, birth plans to me are like weather plans for your vacation, right? This
Yeah.
is how I equate them. Like, okay, I'm going on vacation next week, so I want it to be 80 degrees and sunny and low humidity every day with a light breeze, right? Like, well, of course, that's what everybody wants on their vacation, right?
Mm-hmm.
But that's just not how it works. Like, I could write that on a vacation plan, but that's not going to necessarily happen. So I think, I think that birth plans are, if you have an OBGYN that you trust, they are 90% of the time going to be in a practice where they have partners that they trust. And I think that a lot of birth plans and mistrust of OBGYNs and a lot of birth trauma kind of came from, again, when maybe it was majority men delivering. But there's no OBGYN I know, for example, that's going to cut an episiotomy on you without having a conversation about it with you first, right?
Right.
If they felt that that is absolutely necessary, you don't have to put that in a birth plan. If you have an OBGYN that you trust and a practice that you trust, they are going to tell you or ask you before they're going to perform an intervention on you.
Yeah.
Nobody's going to sneak an epidural into your back without your
It's really hard to
permission.
do that if you guys have seen the needle.
Nobody, right.
No.
I'm not going to do a C-section without your consent. I'm not going to do a vacuum delivery without your consent and without discussing the risks and without going over it with you. So yeah.
Okay.
That's my thoughts.
Great.
I love that. At the Capitol, we snap when people say good things, so I like that.
We do that at poetry slams too.
Yeah.
Love it. Okay, there's a bunch in here that you already talked about, like within the interview, so I'm not going to have you repeat yourself. Have you ever lost a patient?
I have.
How do you come back from that is the question.
Yeah.
That's dark.
Yeah, I don't know that you ever do. I've lost 2 moms.
Ugh.
Oh, gosh, I mean, you don't come back from it. I just feel like I'm gonna cry thinking about it. The first patient was in residency, and I think about her. It's my chief year, and I think about her pretty much every day.
Wow.
Dang.
So yeah, I don't think that you do. And then the second patient was in my private practice, and yeah, I definitely think about her every day.
Ugh.
And her baby.
Oh yeah.
So yeah.
Wow.
So you don't come back from it is the answer. I'm sorry to be crass.
I don't think that you do. I mean, it's like any other trauma or sadness that you experience in life. You know, time makes it
Better.
Time lessens the pain of it.
Has therapy helped? Like, do you talk about it there or not so much?
No, I mean, I don't. I mean, no,
Okay.
I haven't ever talked about it in therapy. But
ACE is a part of everything you do.
It's more
so
just kind of talking about it, the camaraderie of being with my fellow OBGYNs, you know? I mean, we've all had that.
Yeah.
Every single OBGYN I know has had something, has seen something that just seen or experienced something that just shattered their heart, you know?
Yeah.
So yeah, absolutely.
What are your thoughts on period cups? Hard pivot.
Yeah, period cups. Yeah, I think they're great. Right. Like, let's save yeah.
Save
seems environmental.
The plastic and the whatever.
Yeah.
Cool.
Yeah.
Seems great. Awesome. Buy one. Has a dad ever asked you for an extra stitch?
Okay, listen. Yes, many times. And
Really?
Did you punch him in the face?
So typically my response is, the first time this happened, I was so disgusted and taken aback that I didn't have, you know, and I know you as a comedian, Annie, you know, like
you didn't have the comeback.
This is I didn't have the comeback right then, and then like later that night, I'm just like, God, why didn't I tell that son of a bitch, you know?
Yeah.
And so
It's always
now
how
I
it
kind
goes.
of have like my set standard response, you know, and so because this has happened many times.
Do they think they're funny when they're asking?
I guess I don't know. I mean, I don't know.
I don't
But
think that's funny.
They're repulsive, but so typically what I do is I'm like, okay, well, how small do you need it to be? Like, are we talking like
genius.
like this big or
Right.
like
reframe.
you know,
On the small dick.
And so that usually will kind of shut them up pretty quickly.
That's genius.
Like I mean,
Yeah. Okay. So it's like.
yeah.
So we're talking micro.
Right, micro.
Micro-peen?
Okay, yeah, I can work with that.
Nurses, we've got a micro penis
Right.
situation.
Yes,
That's amazing.
Yes, like, can you make an announcement on the overhead speaker? Micro penis, room 3, 2.
That is so good. What is your advice for weird odors? Any food that you suggest to eat or to stay away from?
No. Here, this is Sarah Silverman. The comedian. She has a great stand-up about special soaps and creams and supplements, etc., for your vagina, and I wholeheartedly support what she says about this. So, if your vagina does not, I mean, I don't. Sarah Silverman says, wash your vagina with the same soap that you wash your ass with. Okay. And if at the end of that,
Yeah.
there's still an odor, then you need to go to the doctor. Okay. That is not normal.
Dr. Sarah Silverman and Dr. Melissa Walco co-signed that.
Don't buy any supplements.
Just
Don't get any special soaps. Never ever douche. The vagina is a self-cleaning oven. Never put anything up in there soap-wise.
self-cleaning.
Self-cleaning oven. If there is an odor that is not normal, and you need to go to the doctor.
And they'll figure it out, guys. No judgment. They'll figure it out.
So there's a couple more.
No judgment whatsoever.
Yeah.
No judgment.
None. There's a couple more. I think maybe just because there's a bunch more and we're running long, why don't we, on the day your episode drops, why don't we do these on Instagram?
Okay.
So if you're listening now, check out our Instagram. Maybe we'll do like either like a reel with a bunch of the ones that we didn't have, but we got most of them, and I want to end on this one. Was med school like Grey's Anatomy?
Oh, God, absolutely.
There you go. That's the hope for everyone.
Yeah.
thinking
There you
about
go.
Medicine. Go have sex in med school.
Yeah, there was a lot. I mean, there was a lot of love triangles, love rectangles, love, partner switching.
Quads.
Oh, man.
Love quads.
Yes.
Wow.
Well, you're sleep
doctor,
deprived.
Doctor, nurse,
Yeah.
resident attending relationships.
Ooh, okay.
Secret babies,
Wow.
I mean, there was all kinds of drama.
Love that.
Yeah, and initially when my husband and I were kind of part of that when we first started dating, and I remember just thinking everyone was judging me, and everybody, when we were trying to figure out our relationship at the beginning. And then eventually I was like, oh no, this is everybody. Okay.
Yeah.
Great. Nobody cares about me. This is fun.
Oh yeah, no.
Okay. This was so fun.
So fun.
I could have talked to you for 6 more hours.
I know. We really could keep going. We could always do a part 2. If we get a lot of feedback and there's more questions, like, wait, you didn't say this. We need this. We need this.
Yeah.
Women's health is just.
I also want to, we should have a part 2 where we just talk about all the research that just came out that, like, no one's having sex anymore.
Oh.
It's alarming.
I mean, the AI boyfriends, I'm just like, what? I just am so confused.
I'm scared.
I have so many questions.
Yeah. Oh, this was so fun.
So fun. I'm so glad we got so much amazing insight. And, we just love you. You're a rock star. And you're just like one of one. Truly.
Thanks,
you really
ladies.
are. You're an inspiration.
I appreciate you.
Appreciate you. Well, anything else? Anything else? Do we have any other questions?
Just thank you. You have so much going on. This means so much.
Yes.
Yeah.
Love you, girl.
Thank you, guys.
Well, this has been Joelle.
This has been Annie.
This is Melissa.
Yes, girl.
Catch you next time.
Bye.